Hi, this is Heather Wokusch, and welcome to the program. You know, healthcare reform is one of the biggest issues right now. You hear it discussed everywhere, and what we're going to do today is to give you the truth. We're going to tell you things that are not being discussed on the mainstream media, but things that are absolutely critical for you to know, because healthcare reform is such a critical topic. Now, let's just start with something. In the year 2000, the World Health Organization came out with a study of 191 countries to see who had the best health care. You know, things like access for everybody and how much it cost and the kind of services that you could get. They looked at 191 different countries. Now, where do you think the United States was on that? Top 10? No. The United States was number 37 on that list. 37. That's not really much to be proud of, especially considering the fact that the United States spends more on health care than most other countries. So today what we're going to look at is why is the U.S. number 37 on that list? What are some things that we can learn about health care from other countries? We're going to look at the dirty underside of the whole healthcare reform business, and we also are going to look at things that you can do yourself to protect yourself and also to more effectively raise your voice in this very, very critical topic. Now, my name is Heather Wokusch, and I am an international educator. I'm American, but I've lived abroad. I've lived in Canada and Europe. I've lived in Japan, and so I've experienced some of these systems firsthand. And so I'm going to talk to you a little bit about that. But we're joined today by Beth Hart. Beth Hart is an international development consultant, and Beth is going to share some of her experiences with us.
So what I'm interested in hearing from you is, so what's it like in Austria? What's it like in Europe and in nations that have single payer and national health care?
Well, you know, it's really, really simple. For example, in Austria, everybody's covered. It's universal coverage. It doesn't matter if you've got a job. It doesn't matter whatever. And it's not only your physical stuff that's covered. Your dental is covered. I needed glasses for the first time. My eye check was covered. My new glasses were covered. And so basically everything is covered. And you don't have big waiting lines at all. I can go see any doctor that I want to. And so it's just night and day between what I'm seeing going on here and what is available in other countries. In Japan, it was pretty much the same way. Now, I should say that on this World Health Organization list, Japan and Austria were like 9 and 10, that the U.S. was number 37.
Right.
Now, the question is, you might ask, well, how can you pay for something like this because the service is so good? You know, the bottom line, though, is this. In these countries that were on the top 10 of the list, the bottom line is that the administrative costs are just completely down because it's single payer. Now, what that means is you go to the doctor, you have a little card, you know, that says your identity on the card, you show them the card, and then they bill one place. They're not billing 1,000 different insurance companies, they bill one place. Right. And so, for example, the administrative costs in France are 3%. The administrative costs in the U.S. are 25%. Yeah. You know, and that money is not going to my health. That money is going to, you know, who knows what, 0.1, 0.2. The system is not for profit. In a single payer system, in a nationalized system, it's not for profit. You don't have some big boss making a ton of money and bonuses, and you don't have shareholders who want bigger dividends. The money just goes in. If there's leftover money, then that money goes back to you and your health care. And that's the difference between these two.
You know, one of the things that we don't hear very much in the mainstream media, we just hear, oh, national health care is bad, and in those other countries, there horrible things happen, and people have to wait forever to get health care. You know, oh, I had to wait 6 months for an operation. Well, we have to do that here, and we have to pay for it. So is there anything you can talk to us about? I know when you're talking about these administrative costs, that in the U.S. it is different, though, for Medicare, for the coverage that covers older folks and the disabled, for instance. and some children.
Well, my understanding for Medicare is the administrative cost is around 2%, you know, but...
So even better than what's in some of the countries with single payer.
And some of the things that actually save money, for example, is electronic billing. You know, with this little e-card that I was talking about before, all of my medical records are there. If I get into a car accident, they know exactly who I am. They know what is wrong with me, if I have any, you know, allergies or something like that. So you don't have to send records back and forth. And this is something that's really important.